Hello students, this is Professor Lopez and today we are going over macrolide antibiotics. This is another video on our antibiotic series where we target the most tested upon antibiotics, not only for nursing school, but the NCLEX. We're going to go over the key pivotal components of a medication such as the mechanism of action, the side effects, the specific indications, and most importantly, how do we identify this medication amongst others. As always, before we get into it, if you like content such as this, feel free to like and subscribe as we will continue to put out nursing school content. So, macrolide antibiotics. Macrolide antibiotics are another forgiving medication classification, as all medications in this classification end in the rho-mycin suffix. Whether your medication is erythromycin, azithromycin, or even clarithromycin, if you can identify that rho-mycin suffix, you will be able to identify the other portions of this medication and answer your questions correctly. Now that we can identify what this medication looks like on an exam, how does this medication achieve its therapeutic response? Macrolides specifically are bacteriostatic antibiotics in which they inhibit protein synthesis and eventually lead to cellular death. Through cellular death, this leads to symptomatic improvement and overall relief of client signs and symptoms. What specific disease processes does macrolides treat? I've narrowed this down to four. Now, of course, these are not all indications, but these are the four that you are going to see the most in regards to testing. Number one, we are going to say Heliobacter pylori. This is also usually identified as H. pylori, which is an ulcer inducing bacteria of the GI tract. This is a highly tested upon disease process and specifically for macrolides because clarithromycin is the antibiotic of choice for treating H. pylori infections of the GI tract. Secondly, will be strep infections. So, infections with group A beta hemolytic strep, which is more often than not strep throat. You're also going to see this medication used for upper respiratory infections, whether it's mild or moderate. And lastly, spiral chettle infections such as Lyme disease and syphilis. STDs are usually a very hot topic in regards to antibiotics, so make sure you know which antibiotics can treat which specific STDs. Side effects. We always target side effects because side effects are usually a target for select all that apply questions. So make sure you're able to identify specific side effects in combination how they differ from other antibiotic classes. Your macrolide antibiotics cause, firstly, nausea, vomiting, and diarrhea. I combine these into one specific number because most antibiotics cause GI effects such as nausea, vomiting, and diarrhea. Secondly, and I want you to bold this one out and underline it, and macrolides can potentially cause prolongation of the QT interval. This is a change in the electrical conduction of the cardiac system and is something that needs to be monitored very, very closely. Three, we need to monitor the patient for hepatotoxicity. Now, whenever you see hepatotoxicity, always have in the back of your mind, how, as a nurse, am I going to identify this? And that is always through checking the patient's AST and ALT, also known as the liver function tests or LFTs. And lastly, macrolides can cause rhabdomyolysis, specifically when they are combined with other rhabdomyolysis drugs such as statins, which are cholesterol medications. To round up your macrolides, we are going to discuss four key points that I want you to engrave in your notes as these pop up very regularly in regards to examinations. Firstly, you identify your macrolides with the rho-mycin suffix. Remember, you need to be able to identify a medication before you can answer specific questions on it. So look for that rho-mycin suffix. Second, macrolides are one of the two antibiotics that can cause prolongation of the QT interval. The other antibiotic is your quinolones. So macrolides and quinolones can cause prolongation of the QT interval. 3. Monitor your client's liver function tests as macrolides can alter and cause hepatotoxicity. And lastly, clarithromycin is the antibiotic of choice for H. pylori, which again is an ulcer inducing bacteria found in the GI tract. With these 4 key points and all the content discussed, you should have no issue answering any questions in regards to macrolides. Again, if you enjoy this content, guys, feel free to like and subscribe as we will continue to put out more videos such as this. I'll catch you next time.